So this was, I think, an important study in germ-line pancreas cancer. So we know that about 5 to 7% of people with pancreas cancer will have a germ-line BRCA1, BRCA2 or PALB2 mutation. And in this biomarker selected subgroup, we now have two treatment approaches. We have platinum and we have PARP inhibitors. So this study looked at two different regimens, a triplet of cisplatin, gemcitabine and veliparib, or a cisplatin gemcitabine regimen. And the hypothesis was that maybe adding the PARP inhibitor to platinum would increase the response rate, increase the durability of response, and potentially enhance survival. While we didn't see that, we saw that both arms were very active. We saw very high response rates, 75% in the triplet arm, 65% in the doublet arm. And the triplet was limited by hematologic toxicity. There was more myelosuppression, more dose delays, more dose reductions, although the dose intensity of each individual drug over time was relatively similar. Progression-free survival was interesting, and survival was interesting. And again, in relative terms, in pancreas cancer, recent phase 3 studies in non-selective patients have suggested survivals in the 8 to 12 month range, plus minus. We saw 15.5 and 16.5 months respectively, which is very encouraging and provides a base to build on going forward. And not just that, when we looked at sort of cut points at the 2-year mark, a third of patients were alive. And at the 3-year mark, almost 20% of patients were alive. And again, that's not something we've traditionally seen in pancreas cancer, that there's a nice sort of tail on the curve for this subset. And there are a few questions that arise from this. Is this prognostic because you have BRCA, you just do better? Or is it a predictive effect of the treatment impact? And we actually think it's both, that the totality of the evidence sort of leans to both. And I would say these data complement very nicely the POLO study, which was a randomized phase 3 reported in the New England Journal and presented at the plenary session in ASCO in 2019, and supports the use of maintenance olaparib as a treatment option for patients with BRCA-mutated pancreas cancer. So when we look at the combined perspective from both studies, platinum-based therapy initially and then following on with a PARP inhibitor is a way that may maximize outcomes. And it's nice to see that both of these options are now being utilized more in this subset of pancreas cancer, and we want to get out this message of the importance of genetic testing to be able to identify these patients in the first place.